My name is Matthew Brothers, Pediatric Cardiology at Emory University. My lesson today is how to read a pediatric electrocardiogram, a quick guide for the primary practitioner. So I have two objectives. One, learn the systematic four-step method to reading an EKG. And two, recognize normal findings and call for help when the findings are abnormal. So we've all seen EKGs and we're thinking and we're trying to figure out what they mean. So we're overwhelmed by the information given here at the top. And also there are 5 squiggly lines that can be confusing at times. Not to mention, we always remember back in medical school learning that there are age-related normal values in children. Frequently this is a stressful situation because there's a family clearly worried about their child and want us to make the right decision. So we go from being thoughtful and systematic to being worried and scared that we're going to make the wrong decision. But after this lesson, we will have learned a systematic 4-step approach to interpreting an EKG. So 4 steps to reading an EKG. The first step, look at rate, rhythm, and axis. Second step, everybody should assess the PR section. Third step, the QRS section. And fourth step, the QT section. Let's start from the beginning. Rate, rhythm, and axis. This is a shortcut we've all learned. Go by large boxes, 300, 150, 100, 75, 60, 50. When looking at rhythm, frequently as lead 2 is the rhythm strip, you're looking to make sure that the QRS complexes are equidistant from each other. This signifies a regular rhythm. They should be equidistant from the one before as they are after. And then axis. So the axis, the P wave and QRS should be up in lead 1 and up in AVF. This signifies a normal axis. However, in kids, remember that the axis changes during infancy. And it can be right axis up to about 7 or 8 years old. Next, PR section. 2 goals. 1, make sure the P wave is not tall, and 2, make sure the PR interval is too long or too short. So for the P wave, you're looking to make sure that the P wave is not tall in lead 2, signifying right atrial enlargement, or wide in lead 2, or very negative in lead V1. That can signify left atrial enlargement. Looking at the PR interval, this is age-related and rate-related. In adults, 200 milliseconds is normal. However, in kids, this can vary. So looking at an example, here is an example of a long PR interval, first-degree AV block. Next, here's an example of a short PR interval, Wolff-Parkinson-White syndrome. Notice the slurred QRS complex. Speaking of QRS, what should we ask for the QRS section? Well, first question, is the QRS complex narrow or wide? And 2, are the voltages too large? So let's look. What is narrow? So a normal QRS complex should be 3 small boxes in adults. However, again, in kids, this is age-related. Infants can have QRS complex durations at 70 milliseconds. But if you use the cutoff of 3 wide boxes, that will be a wide QRS complex. Now, here's a 12-lead EKG showing high voltages, concerning for ventricular hypertrophy. Well, what does that mean? Let's look at the leads, particularly for left ventricular hypertrophy. You see lead 1, 3, V1, V5, and V6. There's a lecture later in this course about how to actually determine if it is ventricular hypertrophy. QT section, 3 goals. Make sure the ST segment is not depressed or elevated. Make sure T wave is normal. Make sure QT interval is not long. So let's look at the ST segment. Using the PR segment as a baseline, the ST segment can be either elevated or depressed. So this can signify myocardial ischemia. Next, let's look at the T wave morphology. So there are a lot of non-specific T wave morphologies, but what we're going to focus on are tall T waves for hyperkalemia, T waves that don't come back to baseline, don't start at baseline for repolarization variants, inverted T waves for ischemia and strain, and long slurred out T waves consistent with prolonged QT. Speaking of the QT interval, here let's talk about normal QT versus long QT. So you can use the shortcut of the R to R interval. If it is half the R to R interval, then you can be confident that it is normal QT. However, if it is longer than half the R to R interval, then you should be worried that it is actually a prolonged QT duration. So let's review the 4 steps. The first step, let's look at rate, rhythm, and axis. Second step, look at PR section, the P wave and the PR segment. Third step, let's look at the QRS section. Is it wide or narrow, and is the voltage too tall? The fourth step, let's look at the QT section. Look at the ST segment, the T wave, make sure it's not inverted, and make sure the QT interval is not long. So the key points, remember the 4 systematic steps to reading an EKG, and now that you know normal, call for help if abnormal. Now the family that was worried and concerned can feel happy and relieved that we are now confident in reading an EKG. Thank you, and please visit our library for more lessons on the pediatric EKG.